Are you, or perhaps a loved one, feeling unusually tired lately, or maybe noticing some unexplained swelling? You know, these common complaints among seniors might be more than just the usual signs of aging. They could actually be little whispers from your kidneys, letting you know about high creatinine levels. It's really important not to dismiss these signs. In this discussion, we'll explore the top warning signs, helping you understand what to look for and when it's time to seek help. We hope to bring some clarity and peace of mind to this important health topic. Now, understanding these signals is really the first step towards taking proactive care of your kidneys. You see, as we age, our bodies go through so many changes, and our kidneys are definitely no exception. When creatinine levels in the blood are high, it can be a key indicator that these vital organs aren't functioning quite as well as they should be. And recognizing these warning signs early? Well, that can make a huge difference in managing kidney health and maintaining your overall well-being. So, let's explore these signs together so you can feel more empowered and informed. Number 1, fatigue and weakness. So, number 1 is fatigue and weakness. This is one of the most frequently reported symptoms associated with high creatinine levels and underlying kidney concerns in seniors. We're not talking about just the ordinary tiredness from a busy day or a poor night's sleep. Rather, this is a profound lack of energy that can make even simple daily tasks feel monumental. This kind of overwhelming fatigue can significantly impact a senior's quality of life, making it crucial to understand its connection to kidney function. So, why is fatigue so common when creatinine levels are up? Well, it's directly linked to how our kidneys do their job. You see, healthy kidneys are constantly filtering waste products, including creatinine, from your blood. But when kidney function starts to decline, these toxins begin to build up in the body, a condition sometimes called uremia. This accumulation of toxins can really interfere with various bodily processes, including how we produce and use energy, and that leads to that constant drained feeling. What's more, damaged kidneys might also produce less of a hormone called erythropoietin. This hormone is essential for making red blood cells. So, if you have a lower red blood cell count, which we call anemia, it means less oxygen is being delivered to your muscles and brain, and that directly causes fatigue and weakness. And the impact of this muscle weakness can be especially challenging for seniors, really affecting their mobility and independence. Think about everyday activities that used to be easy, like getting out of a chair, walking upstairs, carrying groceries, or even just taking care of personal needs. These can all become difficult and exhausting. This often leads to a reduced level of physical activity, which, unfortunately, can make the muscle weakness and deconditioning even worse, creating a tough cycle to break unless that underlying kidney issue is addressed. Plus, this loss of strength can also increase the risk of falls, which is a major concern for older adults. So, the big question is, when should this kind of fatigue make you think, okay, I need to see a doctor? Well, if the fatigue is persistent, if it's unexplained by other things like a recent illness or changes in medication, and if it's severe enough to really interfere with your daily life, then it definitely warrants a medical evaluation. It's especially important to seek advice if this fatigue is happening alongside other potential signs of kidney problems. A healthcare provider can run some tests to check your creatinine levels and overall kidney function. This will help them figure out the cause of your fatigue and recommend the best way to manage it. Now, while fatigue can certainly drain your energy, there's another visible sign that often appears when the kidneys are struggling, and sometimes it's right there before your very eyes. So, let's explore what swelling in certain body parts might indicate. Number 2, swelling, edema, in legs, ankles, and feet. Alright, sign number 2 is swelling, which is medically known as edema, especially in the legs, ankles, and feet. This is another common and often visible warning sign of high creatinine and potential kidney issues in seniors. This swelling typically pops up in the legs, ankles, and feet. While, occasional mild swelling can happen for various reasons, any persistent or worsening edema really shouldn't be ignored, as it can be a pretty clear indication that your kidneys aren't performing their filtration duties effectively. So, what's the primary reason for this kind of swelling? It's usually fluid retention. You see, healthy kidneys are responsible for balancing the fluids in your body by removing excess water and sodium along with waste products. But when kidney function is compromised, they become less able to filter blood efficiently and get rid of this excess fluid. As a result, that fluid can accumulate in the body's tissues, and that's what leads to noticeable swelling. This often shows up in the lower extremities, like the legs and ankles, because of gravity, especially if someone has been standing or sitting for long periods. In seniors, the most common areas affected by this fluid-related edema are indeed the legs, ankles, and feet. You might notice things like shoes feeling tighter than usual, or that indentations are left on the skin after you press gently on a swollen area. That's a phenomenon known as pitting edema. And while these are the most typical spots, it's good to remember that edema can occur in other parts of the body too, depending on how severe it is and what the underlying cause might be. It's really important to distinguish between mild swelling that might just resolve on its own and more severe or persistent edema that signals a problem. For instance, a bit of mild swelling after a long flight or on a particularly hot day might be temporary. However, if the swelling is constant, if it worsens over time, affects both legs, or if it's accompanied by other symptoms like the skin feeling tight or warm, then it's definitely a cause for concern. Severe edema can also lead to some serious complications like skin breakdown and increased risk of infection and difficulty walking. And looking beyond the lower extremities, there are some additional concerns to be aware of. For example, any sudden swelling, especially if it's more generalized or pops up in unusual areas like the hands or face, really needs prompt medical attention. Swelling around the eyes, which is known as periorbital edema, and is particularly noticeable in the morning when you wake up, can be a specific indicator of kidney dysfunction. This is because the tissues around the eyes are quite loose and can accumulate fluid easily. So, any such unusual or concerning swelling should always be evaluated by a healthcare professional. Now, beyond these physical discomforts like swelling, changes in a very personal daily routine can also provide crucial clues about your kidney health. So next up, let's discuss how your trips to the bathroom might actually be sending some important signals. Number 3, changes in urination patterns. All right, let's talk about number 3, changes in urination patterns. These changes can be a very direct indicator that something is amiss with your kidneys, since, as you know, these organs play such a central role in producing urine to get rid of waste. Seniors who are experiencing high creatinine levels might notice various alterations in their bathroom habits, and these really should be taken seriously as potential warning signs of declining kidney function. One significant change could be in the amount of urine produced. Some individuals might notice a marked reduction in their urine output, a condition known as oliguria. This happens when the kidneys aren't filtering blood effectively, and as a result, produce less urine. Now, conversely, and this might be a bit surprising, some people with early kidney damage might actually experience an increase in urination, particularly at night. This is called nocturia. This can occur because damaged kidneys may lose their ability to concentrate urine properly, leading to more frequent trips to the bathroom with larger volumes of dilute urine. The appearance of your urine can also offer some vital clues. For instance, if you notice blood in your urine, a condition called hematuria, that's a clear warning sign that should never, ever be ignored. Blood can make urine look pink, red, or even brown like cola. Sometimes, the amount of blood is too small to be seen without a microscope, but it can be detected in a urine test. Another important sign to watch for is foamy or bubbly urine. Now, occasional bubbles can be normal, but if your urine is persistently foamy, it could indicate the presence of excess protein, which we call proteinuria. This happens when the kidney's filters are damaged and allow protein to leak from the blood into the urine. Furthermore, any difficulty or pain experienced during urination, this is known as dysuria, definitely warrants attention. While these symptoms are often associated with urinary tract infections, or, in men, prostate issues, they can sometimes be linked to kidney problems. This is especially true if they occur alongside other symptoms that suggest kidney disease, like the ones we've already talked about. A hesitant or weak urine stream could also be part of a broader pattern of urinary changes related to compromised kidney function. It's really crucial to report any of these changes in your urination patterns to your healthcare provider without delay. Whether it's a change in frequency, volume, appearance, or how comfortable it is when you urinate, these symptoms provide valuable information about your kidney health. Reporting these things early allows for timely investigation and diagnosis, and that can significantly impact the management and progression of any underlying kidney condition. So please, don't just dismiss these changes as a normal part of aging. Now, while changes in urination directly point to the urinary system, the effects of high creatinine can also be felt in parts of the body you might not immediately connect to your kidneys, like your ability to breathe, for instance. So, let's take a look at how your lungs and heart can be affected. Number 4, shortness of breath and chest pain. Moving on to number 4, shortness of breath and chest pain. Now, symptoms like these can definitely be alarming, and while we often associate them with heart or lung conditions, they can also be warning signs linked to high creatinine levels and impaired kidney function, especially in seniors. You see, the kidneys play such a critical role in fluid balance and removing toxins, and when they begin to falter, it can have ripple effects throughout the body, including our respiratory and cardiovascular systems. One major connection between kidney dysfunction and shortness of breath is actually fluid buildup. When your kidneys aren't filtering properly, excess fluid can accumulate in the body. If this fluid builds up in the lungs, it leads to a condition called pulmonary edema, and that makes it difficult to breathe. You might find yourself feeling breathless during activity, or even when you're just resting or lying down. Additionally, as we touched on earlier, kidney disease can lead to anemia, which means a shortage of those important oxygen-carrying red blood cells. Anemia itself can cause feelings of breathlessness and fatigue because the body simply isn't getting enough oxygen. High creatinine levels and the underlying kidney disease can also significantly affect heart function in seniors. Our kidneys help regulate blood pressure, and when they're damaged, blood pressure can rise, putting extra strain on the heart. Furthermore, those waste products that build up in the blood because of poor kidney function can actually cause inflammation of the sac surrounding the heart, a condition called pericarditis, which may then lead to chest pain. And it's important to know that electrolyte imbalances, like high potassium levels, which we call hyperkalemia, can occur with kidney failure. These are particularly dangerous because they can disrupt the heart's normal rhythm, leading to arrhythmias or palpitations. Recognizing severe cases that require immediate medical care is absolutely paramount. So, if a senior experiences sudden or severe shortness of breath or chest pain or pressure, which might feel like a squeezing or heaviness, or if they notice an irregular heartbeat or palpitations, these are definite red flags. They indicate a potential emergency. These symptoms should never be ignored or dismissed, as they could signify a serious complication related to kidney disease or perhaps a coexisting cardiac issue that needs urgent attention. It's also really important to differentiate between breathlessness that happens with significant physical exertion, which might be normal for some people, and breathlessness that occurs with minimal activity when at rest, or that even wakes you up at night, a condition known as paroxysmal nocturnal dyspnea. These latter types are definitely more concerning. Any new or worsening shortness of breath or chest discomfort in a senior, especially if they have risk factors for kidney disease, warrants a prompt medical evaluation to figure out the cause and make sure they get appropriate care. You know, the impact of accumulating toxins doesn't just stop with physical symptoms. It can also start to cloud the mind. So now, let's turn our attention to some of the more subtle, yet equally concerning cognitive changes that can occur. Number 5, cognitive changes and confusion. And for our 5th sign, we're looking at cognitive changes and confusion. Beyond the more physical symptoms we've discussed, high creatinine levels and that associated buildup of toxins in the bloodstream can significantly affect a senior's mental clarity and cognitive function. These changes can sometimes be quite subtle at first, but they are very important warning signs that shouldn't be overlooked, as they can indicate a condition known as uremic encephalopathy, which is where toxins actually impact brain function. So, when the kidneys aren't filtering waste products effectively, these substances, often referred to as uremic toxins, start to accumulate in the body. If these toxins manage to cross the blood-brain barrier, they can interfere with normal brain chemistry and function. And this, in turn, can lead to a range of cognitive and neurological symptoms. For family members and caregivers, noticing these changes can understandably be quite distressing, and it's so important to understand their potential link to kidney health. Some common signs of this cognitive impact include new or worsening confusion, disorientation, meaning they might not know where they are or what time it is, and difficulty concentrating or focusing. Seniors might also experience memory problems, perhaps finding it hard to recall recent events or information. Other ways this can show up include increased lethargy or drowsiness, a general lack of mental sharpness, changes in personality such as apathy or irritability, or even agitation and mood swings that are really out of character for them. It's incredibly important for family members and caregivers to monitor seniors closely for these kinds of subtle behavioral or cognitive shifts. Often, such changes might be mistakenly put down solely to old age or dementia. However, if these symptoms appear relatively suddenly, or if they coincide with other signs of illness or physical decline, then impaired kidney function due to high creatinine really should be considered as a possible underlying cause. Differentiating these symptoms from typical age-related memory lapses usually requires a comprehensive medical assessment. And it's important to know that neurological symptoms can sometimes signal an emergency. If a senior who has known or suspected kidney issues starts to exhibit severe confusion, delirium, seizures, or develop stroke-like symptoms, such as sudden weakness on one side of the body, difficulty speaking, or facial drooping, this is a medical emergency that requires immediate attention. Prompt evaluation can help identify the cause and get treatment started to manage both the kidney problem and its neurological consequences. So, recognizing these 5 key warning signs is really the first big step towards protecting kidney health. But understanding a little bit more about creatinine itself can further empower you. Understanding creatinine and kidney health in seniors. So, let's talk a bit about understanding creatinine and kidney health in seniors. What exactly is creatinine? Well, it's a natural waste product that's generated from the normal wear and tear on muscles in our body. Our kidneys play the absolutely essential role of filtering this creatinine from the blood, and after that, it's excreted from the body in our urine. So, when your kidneys are healthy and functioning well, they efficiently remove creatinine, keeping its level in your blood within a normal range. That's why elevated creatinine levels in a blood test often indicate that the kidneys are not filtering waste as effectively as they should be. Now, seniors are generally at a higher risk for kidney decline, and there are several reasons for this. The natural aging process itself can lead to a gradual reduction in kidney function over time. On top of that, older adults are more likely to have chronic conditions like diabetes and high blood pressure, and both of these are leading causes of kidney damage if they're not well managed. Also, something called polypharmacy, which is the use of multiple medications and is quite common in seniors, can sometimes put a strain on the kidneys or include drugs that can affect kidney function. When to seek medical attention? It's really crucial to understand when these warning signs of high creatinine mean you need to seek prompt medical attention. Symptoms such as sudden or severe chest pain, significant shortness of breath, unexplained and considerable swelling, noticing blood in the urine, or acute confusion or stroke-like symptoms. These are all indicators that require urgent medical evaluation, possibly at an emergency facility. These can signal serious complications. And beyond these acute emergencies, it's so important not to dismiss any persistent or worrisome symptoms, even if they seem mild at first. Regular checkups with a primary care physician play an absolutely vital role in monitoring kidney health, especially for seniors. These visits allow for routine blood and urine tests that can detect high creatinine levels or other signs of kidney trouble early on, often before noticeable symptoms become severe. And this, of course, enables timely intervention and management. So, to wrap things up, being vigilant about these warning signs of high creatinine, from fatigue and swelling to changes in urination, respiratory issues, and those cognitive shifts, is truly paramount for seniors. Your body often provides clues when something isn't quite right, and paying close attention to these signals from your kidneys can make a profound difference. Early detection and proactive management are absolutely key to achieving better kidney health outcomes and maintaining a good quality of life as you age. So please, don't ever hesitate to discuss any concerns you might have with your healthcare provider. If you found this information helpful, please share it with friends and family who might benefit. Do you have any questions or experiences to share regarding kidney health or creatinine? Please leave a comment below. We would love to hear from you and foster a supportive community.